I'm Dr. Daniel Medell, an anesthesiologist. In this video, I'm going to tell you a story about a case I had where my patient developed a rare and life-threatening allergic reaction right on the operating table within just a few minutes. And I'm going to show you the subtle warning signs I'm trained to spot and the immediate steps you have to take in order to save a life. Let's check it out. It all started during a normal routine surgery. I've managed thousands of cases in my career, but this time, about 20 minutes after induction, the scrub nurse noticed a red patch on the patient's forearm. It looked like a few raised red bumps, hives. In a different setting, someone probably wouldn't be too concerned about it. They might figure they'd just take an antihistamine later. But this is a trap that a lot of people fall into, thinking it's just a minor issue that'll go away on its own. The truth is that a life-threatening allergic reaction, also known as anaphylaxis, can happen to anyone at any time, even if you've never had an allergic reaction before. And that patient's body was about to teach our whole team that lesson in a really terrifying way. When the nurse initially told me about the rash and I went over to take a look, I wasn't that worried about it. It was really a pretty small patch of red skin. But within about 10 minutes, it was already spreading across the patient's chest and neck. That speed is one of the key differences between a mild, contained reaction and something more systemic. In a conscious patient, these rapidly spreading hives are usually accompanied by a growing sense of unease, often called a feeling of impending doom. It's a pretty bizarre symptom, but it's one that many survivors of anaphylaxis report. It's the body's primal alarm screaming that something's really going wrong here. Some people try to dismiss it as anxiety, but that's a big mistake. When your immune system has flagged something like a drug, a food, or a bee sting as a catastrophic threat, it launches an overwhelming full-body counterattack. And that's what was happening to my patient that day. Their immune system was flooding their body with a massive amount of chemicals that were causing them to spiral into anaphylactic shock. A mild allergic reaction might just show up as a small rash or a runny nose. But anaphylaxis often involves multiple body systems. In some cases, it's diagnosed as soon as you have trouble breathing or a sudden drop in blood pressure after contact with an allergen. This patient's skin was already affected with the hives. The next system to go was their respiratory system, and that's when things went from, oh well, I don't know, to, okay, stop the surgery, something critical is happening here. In a conscious person, it might start with what would feel like a little tickle in your throat. Then comes a dry, persistent cough, and you might notice that you're having trouble swallowing. But soon it would feel like your whole throat was getting more and more narrow. This is one of the most dangerous signs because swelling of the throat, lips, or tongue can rapidly block your airway. The point of no return for us was a sudden tightness in the patient's chest, which we saw as increased pressure on the ventilator. It became harder and harder for the ventilator to push air into the patient's lungs. And when I listened with a stethoscope, I could hear high-pitched sounds every time they exhaled. That's called wheezing, and is usually a sign of severe and life-threatening airway constriction. And that's when my alarms started screaming. The heart monitor showed a rapid but weak pulse, with a pretty frantic rhythm on the EKG tracing. If a person in that state tried to stand up, a wave of dizziness would wash over them and the room would tilt sideways. That's a classic sign of a sharp drop in blood pressure, which is one of the hallmarks of anaphylactic shock. Your body's losing the fight to keep blood flowing to your brain and other vital organs. In my case, the patient's skin, which had been red and flushed, was now pale and clammy. These are the undeniable red flags that scream medical emergency. Skin reactions plus breathing difficulties, trouble swallowing, a rapid pulse, and dizziness. At that point, the body is fully in shock, and without immediate intervention, it can lead to loss of consciousness, cardiac arrest, and death. Some people also experience severe stomach cramps, vomiting, or diarrhea for the same reason I mentioned before, lack of blood flow to those organs. And remember that feeling of impending doom I mentioned? It's often described by survivors as a full-blown conscious terror, like an absolute certainty that their life is in danger and they're about to die. When anaphylaxis strikes, time is your enemy. The progression from mild symptoms to a crisis can happen in minutes, but if you recognize the signs, there are 3 things you need to do to save a life. And this is for anyone, anywhere, whether you're in the operating room or on the street. First, and most importantly, call for help. In the hospital, we call a code or an alert. That tells doctors and nurses in other parts of the hospital that I need help now. Outside, you call 911 or whatever the emergency services number is in your country. Don't wait. Don't hang around and see if things improve on their own. The moment you suspect someone's having an allergic reaction, especially with dizziness or trouble breathing, call for help. A common mistake is waiting too long. Tell the dispatcher, I think someone's having an allergic reaction and they're having trouble breathing. The second step is to administer epinephrine immediately if possible. Epinephrine, which is the same thing as adrenaline, is often carried by people with allergies in the form of an auto-injector, like an EpiPen. It's the first and most important medicine that can quickly reverse the life-threatening symptoms of anaphylaxis. It works in minutes to raise low blood pressure, relax airway muscles to improve breathing, and suppress the body's chemical flood. Antihistamines like Benadryl are not a substitute. They work way too slowly and can't stop that airway closure or shock. If the person has an auto-injector, help them use it to give them some epinephrine. It usually goes in the outer thigh. I'll put a link in the description to a quick video from the Cleveland Clinic about how to use an EpiPen, in case you're interested. And remember, if symptoms don't improve after about 10 minutes, official guidelines say that you can give a second dose if available. The third step is to position the person correctly. This is a vital and often overlooked step. If the person feels dizzy or looks pale, you should lie them down flat on their back. You can also try lifting their legs to help improve blood flow to their vital organs. But if the person is having significant trouble breathing, it's better for them to sit up. You can imagine how being unable to breathe and having someone push you to the ground to try and make you lie on your back would be a pretty terrifying experience. So just help them sit up, but try and give them a little bit of space so they don't feel closed in by a crowd. The one thing you definitely should not do is let the person stand up or walk around, because that can cause a sudden, sometimes fatal drop in blood pressure. If they feel like they might vomit, just help turn them onto their side, but don't let them stand up if you can help it. Knowing what to do is half the battle, but knowing what not to do is just as important. So try to avoid these critical mistakes. First, as I already said, don't wait to call 911. In studies of fatal food-induced anaphylaxis, the average time from the onset of symptoms to having severe symptoms was 20 minutes. But the time from severe symptoms to cardiac arrest was only about 10 minutes. So hesitation can have devastating consequences. Calling 911 immediately gets help on the way early. Second, do not give the person anything to eat or drink. From an airway management perspective, even water can be a choking hazard if their throat is swelling. Third, don't rely on an asthma inhaler alone. If someone with asthma starts wheezing, it's tempting to think their rescue inhaler is the answer. While it can help with the breathing symptoms, it doesn't do anything to stop the underlying systemic reaction. It won't stop throat swelling, or make the hives stop itching, or prevent the catastrophic drop in blood pressure. Epinephrine is always the first-line treatment for anaphylaxis. And finally, never leave the person alone until help arrives. The symptoms of a severe allergic reaction can get worse in an instant, even if they've already injected themselves with epinephrine. They need someone to look after them and to help talk to emergency responders for them. So just stay with them and reassure them that help is coming. In the case of my OR patient, the team's response was a blur of focused activity. We confirmed that the patient really was in anaphylactic shock, gave multiple doses of epinephrine and other medications through the IV, and finally managed to stabilize them. But even after the immediate crisis was over and they could breathe easily again, they weren't totally out of the woods. After the surgeons quickly finished up, the patient was kept intubated under anesthesia and transferred to the ICU for close observation. That's because of something called biphasic anaphylaxis, where a second wave of symptoms can hit hours after the first, even with no more exposure to the thing that caused the reaction in the first place. But thankfully, that didn't happen in this case, and by that evening, the patient was extubated and feeling totally fine. They had no idea that anything had even happened. But leaving the hospital was the start of a new chapter for this patient. They were referred to an allergist to pinpoint exactly what the triggering agent was. This is super important because if the patient doesn't know what caused it, they can't tell the anesthesia team about it next time they have surgery, and that means it could happen all over again. They also walked out with a prescription for 2 EpiPens and a clear action plan. They had to learn how to use them, teach their friends and family, and advocate for themselves. For many survivors, the anxiety and fear can live with them long after the physical symptoms fade. It takes time to regain confidence. The line between a minor reaction and a fatal one is shockingly thin, and it's drawn with subtle signs. Hives that spread, a cough that won't quit, a strange feeling of dread, a wave of dizziness. Recognizing that progression is a skill, so remember the steps. Call for help immediately, use epinephrine if you have it, and position the person correctly. Don't wait, don't guess, and don't underestimate how fast a reaction can escalate. Knowing these signs and taking these actions turns a bystander into a first responder. And in the face of a rare and deadly allergic reaction, that can be the difference between a tragic story and a story of survival. Thank you so much for watching, and I'll see you in the next one.